everyone, Cameron Eldred here, doctorate in athletic training student through Indiana State University. And today we're just going to be talking about my approach to my clinical practice. The point of this is to allow me to critically reflect on my clinical practice as a whole and as it kind of pertains to the domains of athletic training. So the first thing that I really kind of wanted to hit on is I really hope that the music introduction to this video got you pumped for this conversation, because I'll tell you what, this semester was absolutely mind-blowing. And I learned a lot about myself as a clinician and just all of the things that I thought I was fantastic at and how I need to improve. So the first thing that we're really going to look at is the injury, illness, and prevention domain. And, you know, the funny thing is a lot of these things that the domains take care of, there is a patient-rated outcome or a clinician-rated outcome that you can use in each of these. And that was one thing that I was sorely lacking in, especially just because, you know, I mean, this is my first year practicing, and that's really not an excuse. I apologize, Dr. Games. But I had never had the opportunity to see any of these in practice because, sadly, where I came from, you didn't see them get used a lot. But having the opportunity to look at strength testing, functional testing, and using those things as indicators as to whether or not somebody is, you know, lacking in an area when it comes to lower extremity, or even a patient-rated outcome such as the FADE or the FADE sport. I had the opportunity to use the FADE sport throughout the semester, and I'll tell you what, man, it was an absolutely mind-blowing experience to be able to look at this and say, wow, this person may have a deficit. Maybe we need to work on this. And seeing them improve. Using like the FADE hand in hand with something like the disability or disablement in the physically active scale. You know, those are all things that I had never even known about that I was beginning to use in my practice for both injury and illness prevention. You know, and those are more injury prevention. Illness prevention, I have notes posted everywhere outside of my office, and I've asked the school to post them all over the place, just about washing hands, cough into your elbow, you know, ways to prevent illness, especially right now. I mean, right now is a time of illness. It just is. Wintertime is just crazy. It's hectic, colds, flu, everything else. So this course really provided me with the opportunity to look at myself and say, wow, why am I not using these things? And if I am using these things, am I using them properly? And to be honest with you, I wasn't using them. I really wasn't. But I use them all the time now, or I shouldn't say all the time. I use them as frequently as I can, as frequently as I remember. You know, and that kind of comes back down to the exam, the assessment, and diagnosis. Is this class has really helped me kind of narrow down my clinical examination. It has really helped me to look at, you know, am I doing things efficiently and effectively? And if I am assessing, you know, a lateral ankle sprain, or what I assume to be a lateral ankle sprain, am I doing special tests that maybe don't need to be done? One of the assignments we did this semester was looking at the lateral ankle sprain assessment as we compare to an MCL. And those are two totally different realms. I mean, those are two totally different injuries. But it made me think about, you know, how systematic am I, really? And if I'm doing certain things, why am I doing those things? It provided me an opportunity to reflect. And the funny thing is I did terrible on the assignment. I'll be the first one to tell you it was not my best assignment. But I went back and reflected on it, which made me just want to further the process. And I'll tell you what, I learned so much about myself as a clinician from that assignment. And it provided me the opportunity to begin to change things, the way that I do my systematic evaluation. You know, and having the opportunity to do examinations here in my clinic and things like that was just, it was awesome. You know, and I do want to talk a little bit about using patient-rated outcomes, clinician-rated outcomes, things like that, such as the Star Exertion Balance Test, you know, using the FADE sport, being able to actually work with all those patients who were showing deficits. And one of the things that Dr. Games had brought up in one of my assignments was, do you have enough time and enough space? Because in theory, it is awesome to be able to work with every single secondary school patient that you have that has a deficit. But I can't. And that actually broke my heart at first, because I want to help. and I want to be there for them, but I don't have the time and I don't have the space. And a lot of that just has to do with the fact that they have to be in class. So, I take time out of my day to get here a little early, and there's a 2-hour window where they can come in and see me, and then they've got to get back to their normal classes. And they have to actually not go to lunch or eat their lunch extremely fast during one of those hours to come down and see me. And, just the time is not there. Neither is the space. My office is 10 by 10. It's tiny. But we make things work. I get things done, and I work with those who I can tell definitely need it, and I give home exercise programs to those who don't need to be right here with me. And again, that comes down to small incremental changes make the big sustainable changes. Those small things add up, and they make things bigger, and they make things better. And, we're going to have, in 2 years, we'll have a better athletic training room for the patients to come out and do things with me. And it will be right in the weight room. So I won't have to go, upstairs and halfway across the school to do something with somebody in a weight room. So it'll provide a lot more opportunity to be able to continue building upon the small incremental changes that I'm making while I'm here. Immediate and emergent care, I haven't had a whole lot of opportunity to work with this, to be honest with you. So it's kind of been hard for me to be able to assess myself in this. And I think that that's something that I don't hope that I have to deal with that. But if I do, I hope that I react in the way that I would think I would. During simulations, I had the opportunity to work with an emergent patient, and I felt like it was handled very well. But again, that was a simulation. It wasn't real life. And I apologize because I shouldn't think that way, but I did when I was doing this assignment. Now, in the moment, I was like, oh my gosh, this is happening. Let's take care of this. Let's get it done. It felt real. But now that I'm looking back, I think, and I hope that I would react in the same way that I reacted in that simulation. Therapeutic interventions. Sadly, the only thing that I have around here is therapeutic exercise. And we hit it hard, and we do a fantastic job of doing it. And I've been able to actually use patient-rated outcome measures as well as clinician-rated outcome measures to prove to the coaches and the stakeholders that, having an athletic trainer here is beneficial, that this is something that the students, the patients, can benefit from. And we're making small changes. We're starting to get more coaches who are willing to do more dynamic warm-ups. We're getting coaches who are more willing to do standardized stretching after warming up, things like that, things that had never been done around here that are truly beginning to help within this area. The last thing that I really kind of want to touch about, and man, I could go on for hours about all the information I've learned this semester. I apologize. I feel like I'm speeding through this super quick. But the healthcare administration and professional responsibility, I've had the opportunity to work with many different clinicians, both interprofessional as well as intraprofessional. So both athletic trainers, PTs, chiropractors, Pilates instructors, yoga instructor, orthopedics, surgeons, stuff like that. And the one thing that I've noticed is my skill in talking to them and being able to talk about the different things I'm doing with the patients has become easier. I've been able to talk more with my fellow DAT students about the different PROs that I'm using or clinician-rated outcomes that I'm using, the success I've had, the failures I've had, and those are extremely educational conversations. And I truly appreciate this class for that. Because I'm not going to lie, without this class, I don't know if I would have been able to make those changes the way I have. And overall, I feel like I've grown as a clinician. I'm definitely not the same as I was at the beginning of the semester. Things are just getting better. I'm starting to find ways to do different things and use different things within my practice. So my time is almost up. I apologize. This was very, very quick. And I hit the very basics of the things that I've learned. But again, I would encourage anyone out there who, wants to improve as a clinician, look into the DAT. Because the only thing you can do for yourself is help yourself. Have a good one.